view the recording after this meeting. So, all right, Grace, you should have the ability to share your screen?
Yes, let me get this set up here. Goodness, are you guys seeing my slides right now?
We can, yes.
Awesome. All right. Well, thank you so much for inviting me. I'm Grace Jensen. I'm one of our wastewater EPIs on the wastewater surveillance team at our state program. So I'm just going to give a really quick overview of what our program looks like, how we're structured, and how we disseminate our wastewater surveillance data. So for anyone that is new to wastewater surveillance, what is it? It is a method that tracks disease trends by monitoring. Oh, sorry. Can someone
please make sure you mute your computer during the presentation. Thank you.
I'm like a dog to a squirrel, gotta focus on one thing. So what is wastewater surveillance? It's a method that tracks disease trends by monitoring infectious pathogens shed by individuals into our wastewater. It's really useful. It can find early signs of diseases in a community without really needing to test each individual person in that community. And we're able to help healthcare providers and local state health agencies allocate resources depending on what we're seeing. And it also provides additional data that could really form a more robust approach to public health monitoring. So some of the benefits of wastewater surveillance, it's a really non-invasive way to track illness in a community. Again, it doesn't rely on folks having access to clinical data or utilization of those testing. It helps people understand the risk of disease in their communities. So we kind of get this estimate of overall disease burden based on our wastewater data. We're also able to find cases of illness in people that may be asymptomatic. This was a really huge aspect of COVID-19 monitoring, that folks were walking around in the community that they weren't necessarily symptomatic, so they maybe weren't getting testing. And we can also identify new strains of a virus sometimes before we see it in our clinical samples. Some other benefits is that it can help detect increasing trends of illness. And again, it can help healthcare providers and public health provide resources to those areas. We also share our data to our national dashboard. So not only you can look at what's going on in Colorado, but you can look at what's happening nationwide as far as those pathogens that are shared. And it doesn't rely on healthcare access, and it's really helpful for tracking illnesses with limited pathogen-specific clinical testing. So for example, we do EVD68 testing, and that is something that is a very limited resource as far as clinical tests. We work really closely with Colorado Children's for our surveillance system, so it's a really great way to kind of fill that gap in surveillance. There are some limitations. We are unable to identify one principal person who is sick. So for example, for measles, it's really important that we do find that principal case when we're doing an outbreak investigation. And that is just something we're not necessarily able to do with wastewater surveillance. We're also not able to capture folks that are on septic systems. So you'll see a map of kind of what our program looks like and where we're testing. And you'll see in the eastern region of Colorado, we're really under-resourced just because those are rural areas and a lot of those folks are on septic systems. And there's differences in population movement patterns. So in our high tourism areas, we're going to have a lot more people moving in and out of that area on a daily flux, more than necessarily one of our metro areas. And we know that different people shed virus in different amounts. So there's not this one specific amount that we can equate to, hey, we're seeing this much virus in wastewater, so we know that this many people are shedding the virus in wastewater. That's just not necessarily how we approach our data. A couple other limitations, it's a very complex and emerging science. Results may vary between utilities just based on differences in the populations there and the flow rates and things like that. And also environmental effects aren't fully understood. So maybe we get a lot of rainfall and we're kind of diluting our sample. How much does that affect the viral material that we're seeing? And also the fragmented genomes that come in this pooled sample can sometimes lead to a more difficult interpretation of the variants that we're seeing. So here's a very quick overview of the surveillance process. So we first get our raw sewage sample from our utility partners. They get it at their headworks building. It's where that huge pipe comes in with the huge influent wastewater comes in, and they'll use an auto sampler. So it'll test every hour on the hour for 24 hours. So we kind of get that 24-hour snapshot of what's going on. And then the lab will receive and process the sample, test the sample, and then send it to the data team, which is me. And we'll analyze the data and post that data to our dashboards. So this is a large kind of timeline, but I'll kind of go over like a few points of kind of how we've evolved throughout the years. So we started really early in 2020, where utilities formed this informal collaborative with BioBot, which is a private wastewater testing company. And as things began to, kind of heat up with COVID, the CDC kind of made room for state programs to grow. And so us at Colorado, we began monitoring with 17 utilities statewide in partnership with the University of Denver. So, kind of as the years went on, we started to hire more lab folks and dedicated epi folks to our wastewater team. We added Omicron detection tables and kind of increased what we were testing for. So we added like flu and RSV. And in 2022, our program actually got awarded as a Center of Excellence. So we actually have our utility partners and our academic partners at the University of Denver oversee a section of the United States. And so we give some, much needed guidance and kind of mentorship to smaller programs within our jurisdiction. And as you can see, we've continued to grow and add on new targets. And, anticipating the loss of funding and just wanting to make sure we protected the sustainability and longevity of our program, we implemented kind of a more economized model that I'll go over in the next couple of slides. So here's what our current program model looks like. On this map, you can see the 10 different regions that we chose to represent in Colorado. The triangles are our Sentinel sites. So those are our sites that we test twice weekly at. Those are our routine testing sites. Then we also have our emergency surveillance sites, and I'll talk about that in just a moment. So our 20 Sentinel utilities, there are 10 utilities serving the largest populations within each of their regions. We also added 3 additional utilities in the Denver metro area. That's just where a majority of folks in population density lives in Colorado. We also added 4 extra utilities that have high tourism areas. So places like Aspen and Telluride. If anyone remembers, in Colorado, our first principal case of COVID came through Aspen. And so we figured that adding on these high tourism areas, we're able to kind of see are people coming in and, spreading disease when they're coming in and visiting Colorado. And then our emergency wastewater surveillance system. So at the height of our program, we were testing at over 60 sites. And like I mentioned earlier, just with the uncertainty of funds and things like that, we knew that that just wasn't sustainable. And so when we moved down to the Sentinel surveillance site model, we didn't want to lose out on folks that we had been testing with before we moved to that model. And so we asked them to join our emergency wastewater surveillance system. So this is a short-term emergency system that can be activated when rapid public health response is needed. We're able to monitor a pathogen spread across communities. So we don't have to activate the whole state. We can activate regionally if we just want to take a more granular look at what's going on. And we're also able to respond more effectively to outbreaks this way. So this was a great way for us to continue to, foster those really good relationships with our utility partners, even if we weren't testing with them routinely anymore. So here are the current targets that we're testing for. On our public dashboard, you'll see COVID, flu, RSV, EVD68, and Mpox. We are currently in our pilot phase for measles, of course, West Nile virus. We're also testing for Candida auris and antimicrobial resistance genes. And so while we're in our pilot period, we are posting those to our internal dashboard. Most of those to our internal dashboard. We're just trying to figure out the best way to trend and visualize those before we push those to our public data. So how do we determine the future targets for surveillance? We really want to look at what existing data is out there. What do hospitals and doctors already provide? How is public health tracking this disease already? And what are the consequences of looking for this disease, or the non-consequences, right? We wouldn't want to, add something to our repertoire that might be redundant data. We also want to know, what groups will use the data. Is this actually going to be useful to add to our testing routine? And what public health actions can be taken with our data? So these are questions we ask ourselves every time we think about adding or onboarding a new pathogen to our program. So here's just like a quick look at our data that we share publicly. We do have our public dashboard. It's updated twice weekly. We also do have an internal dashboard, and that is for our LPHA partners and our utility partners, so they can kind of get a look at the data about 24 hours in advance before. And thank you for sharing that, Stacey. 24 hours advance before we share that to our public dashboard. We also share our data, like I mentioned earlier, to the National Wastewater Surveillance System website. So that'll be housed on the CDC website. So for most of our pathogens, except for the ones in pilot period, you'll be able to look at what's happening in Colorado, as well as what's happening nationwide with other wastewater programs. And we really pride ourselves on our community engagement initiative. We regularly host town halls and information sessions, as well as attending, various conferences and educational festivals to really help educate and engage our community on wastewater surveillance. So if there are trends of particular public health concern, we also make sure to work with the subject matter experts within our branch and also with our local county partners in order to really ensure just that efficient messaging is going on. So here's our overview of our public dashboard. This is the newest version that we have. It was launched in March of 2025. It includes all of the current pathogens that are being monitored publicly, along with a summary of detections and trends. And we also link to statewide regional clinical data for respiratory pathogens, so you can take a look at what's happening on the wastewater side and then look at what our state has to offer as far as those respiratory pathogens. And then we also break down between, we subtype flu A and flu B. We also subtype Mpox clade 1 and clade 2. On the main section of the dashboard, after you've clicked on the pathogen you'd like to view, you can explore a summary of trends at each utility that we monitor. You can also select the utility you'd like to view, so you can get a closer look at the sewer shed boundaries. For example, I clicked Boulder on this example, so you can just kind of see what's going what the boundaries look like. We also integrated a zip code feature, so users can type in their residence and just kind of see what sewer shed is local to them. And then we also added viral concentration graphs. So you can look at viral concentration graphs for all of the pathogens except for Mpox on the dashboard. And you can change the date period you'd like to look at using the filter at the top. So you can just kind of see over time what the viral concentrations are doing at each of the utilities. And here's an overview of the trend categories that we calculate and use for most of our pathogens. This displays detection categories for flu, RSV, EVD68, and Mpox. And these are different from our trend classifications we use for COVID. We use a much more involved trend model for COVID, just because we have the most historical data for it, as we've been testing for it for over 5 years now. And there's a really high baseline of COVID in wastewater. Like I mentioned earlier, just each of our pathogens do shed differently into the wastewater. So just with our historical data, we have a little bit of a better understanding of how COVID reacts in the wastewater. But every pathogen is different. So we can't use the same trend model across all of our pathogens. So on our dashboard, we will have all of the information you need to, the definitions of each of our trend classifications, and of course for COVID as well. And like I mentioned earlier, we subtype flu A and share those results on our dashboard. So you can see the different strains under flu A, if it's H1 or H3. And of course, we also test for H5. We only test H1 and H3 seasonally during respiratory season, but we will test for H5 throughout the year. So what are some applications of our wastewater data? It's a really robust approach to public health monitoring. It really complements the data that is already existing. It provides this really high-level snapshot of disease trends in communities, And like we learned with COVID, these wastewater surveillance trends may lead clinical indicators. And most recently, we had an example of where we detected measles in Grand Junction, and that happened 3 or 4 days before we saw an actual clinical case pop up in that same area. It can also be used to indicate the start of respiratory season. So when to begin messaging about vaccinations or other preventative measures is really helpful. And it's just a really great tool to add to our toolbox to respond to these emerging pathogens as we're seeing them. So I could talk about this for hours. We have just a really incredible program, and I work with just the most innovative people. But if you have any questions, we very much would love you guys to reach out to our inbox. It's a little confusing here. The spaces are underscores, so it's CDPHE underscore wastewater underscore. But yeah, we'd love to see you guys in our inbox and continue to have these conversations about how you guys use our data and how we share our data can be most useful for you. But with that, I will turn it over to someone else.
Thanks, Grace. I appreciate that. Does anyone we have a couple minutes just for quick questions. Anyone have a question for her? Well, if you do in the future, you think of something, please reach out to her and the team. They're great to work with and happy to answer any of your questions or needs. So with that, I'm going to go ahead and turn it over to Sining, and she's going to show the respiratory dashboard.
Thanks, Stacy. Can you hear me okay?
Uh-huh.
Okay, perfect. As Stacy mentioned, my name is Sining Chan. I am one of the epidemiologists on the Boulder County Public Health Emergency Management Communicable Disease Program. I am here to share a respiratory illness dashboard that we put together. I believe we launched it last winter. So if you can't see my screen, just let me know. But this dashboard was actually put together, I believe, during COVID by our one of our epidemiologists or one of our data specialists at the time. It used to live in Tableau, but due to recent funding decreases, we have moved over to using R. So we're really just relaunching this dashboard, and it might look a little bit different. I don't know if it was presented to you all previously. All of this data, though, is pulled from syndromic surveillance data. So it comes from hospital data, mostly hospitalization and ED. It's all aggregated the way that we get it. So it doesn't come in at the individual level, but it does give us a good idea of what's going on in our community and how our respiratory viruses are circulating. We did just start updating this last week or maybe the week before, as we're starting to see respiratory illness increase again across the state. So this first graph that is here on my screen just goes over our hospitalizations per 100K population. Like I said, this comes in through our hospital systems. It's reported to this, I believe it's a national database actually, that we pull this data from. So let's see here. So you can see here we have pretty low levels of respiratory illness at this moment. We have this red line here that indicates a data lag line. So basically anything to the right of that line, we don't see as like the data hasn't quite stabilized yet. So anything left of the line is going to give you a better idea of what's actually going on in the community, just because sometimes there is a data lag. So people are reporting things, or the hospitals are reporting their data just a little bit late, or those numbers hasn't fully updated yet. So nothing too concerning at the moment, no huge peaks or anything like that, especially as compared to the last couple of years. Our green line is COVID, our dotted or dashed pink line is influenza-like illness, and then our purple dotted line is RSV. So yeah, just something to keep an eye out for. And then the second graph here, it's not a very big dashboard, but the second graph here goes over our ED visits by diagnosis. So it's the same different pathogens. Again, dashed line, for influenza-like illness, dotted line for RSV, and then the green solid line is the COVID-19. And again, not too many concerning trends, but we are seeing things start to increase just coming out of the summer. And yeah, just something to keep an eye out on for you and your facilities, to see if there's any respiratory illness coming your way, to see if there's any like precautions you want to start implementing in your facilities as well before they start to increase. So I feel like this information that we can share with you, and this is all public. I can actually, I don't know if Stacy, you put this in the chat already, but I'll go ahead and drop the link in the chat.
I
But
put it in there.
Okay,
So.
perfect. This, along with Grace's team's surveillance, as well as I think are two really strong tools that you all can use for your long-term care facilities to see if something's about to hit you sooner than you think. So yeah, I'm happy to take any questions. Not a lot of updates there, pretty small dashboard, but yeah, any feedback or questions or comments or anything like that, I'm open to them. So feel free to unmute or put it in the chat, or you can always reach out to our team via email.
Can you put our email address in the
Yeah, I can.
Great. Well, with that, I really wanted to just open it up for quick questions and concerns that you had. First off, though, I do want to announce that next week, I guess, the long-term care call is happening through CDPHE on the 8th of October at noon. So if you haven't signed up for those meetings, you can do that on their website and in their COVID website under long-term care facilities, same place that you find your guidance for your facilities as well. There is going to be quite a few changes to the guidance affecting both long-term care facilities and assisted livings. I don't have that information yet, so I'm kind of waiting with you guys to have that posted. I'm not sure when they're going to post it, but I do know that they're going to go over all of that information at the next meeting. So more to come on that. With that, does anyone have any questions or concerns they just want to bring up to the group while we're all here? Okay. Well, with that being said, it's good that we are meeting. We're going to try to meet once in a while, kind of pick up these meetings like we did before. And if you have any suggestions, something you want us to bring up to the group, please reach out to us and we will be happy to accommodate that. I hope you have a great rest of your lunch hour, and we will see you next time. So thank you for attending. Thanks, Carol.
Thank you, Stacy. Glad you got the group back together.
All right, everyone have a great day. I'm going to stop my sharing.